Victoria was once considered a leader in mental health services, but a new report has found years of underfunding has left the state trailing the rest of the country. The study by Mental Health Victoria found the state spends less on mental health per capita than other states, and just 1% of Victorians receive mental health care, 39% lower than the national average. We're joined now by the CEO of Mental Health Victoria, Angus Clelland. Angus Clelland, thanks very much for your time. You're launching this report tonight. Talk us through the key findings.
Well, the key findings are a pretty worrying picture for Victoria. Mental Health Victoria brought together experts from across the sector, psychiatrists, nurses, doctors, community workers, police and ambulance service officers and others, to identify where Victoria sits in relation to the rest of the country and to find out where those gaps are. And we're quite alarmed to see where Victoria sits in relation to the rest of the country. As you pointed out, spending is particularly low. We are the lowest in the country, but access to services, particularly for young people and for adults with complex mental health issues, are very low in relation to the rest of the country. And this is a result of a lack of investment by successive governments.
So when you drill down into these figures, over 90,000 Victorians experiencing severe mental illness each year do not receive the care that they need.
That is absolutely correct, yes. The data that we're using comes from the Australian Institute of Health and Welfare and the Victorian Government's own data. Part of the purpose of the report is to draw attention of the Victorian population and the political parties, given that it's an election year, to the plight that we face here in Victoria and to encourage new investment in the system that, as you point out, was the flagship for the country, but now trails the rest of the country.
And I think many people would be surprised to hear that. How has the introduction of the NDIS affected mental health services in Victoria?
In Victoria, it's caused us some particular issues. Now, a decision by the former government to cash out or effectively wind down community-based mental health services and transfer them across, or the funding across, I should say, to the NDIS, has meant that we've lost very significant capability within the community mental health system, and that directly correlates with prevention and recovery services that people need. The end result has been that people are turning to emergency departments to get their care, and that's the first point of care. And we're seeing record numbers here in Victoria. So 20% increase in the last 4 years, and every 10 minutes we now see a mental health emergency department presentation. That stretches to the limit the hospital system, but also police and ambulance officers that are part of that response.
Yes, so 1 every 10 minutes.
That's correct, yes.
The other figure that I find really disturbing in your report is that 2 out of every 3 young people in Victoria who need mental health services are turned away.
That's correct, and that's one of the most worrying findings that we've presented. Now, if we use as an example the award-winning service of Origin, started by Professor Patrick McGorry, 3 in every 4 young people are turned away from that service because they simply don't have the resources available to respond to the need. So part of our response to this is to recommend that we front-end and prioritise spending on those community-based prevention services for young people and for adults within the community. We do need more beds, and they're important, but just as important is the prevention side, and particularly for young people. If we get in there early, the results are terrific, and the return for the economy, the Victorian economy, in terms of productivity and jobs and what have you, is very, very significant.
This is a really bleak picture. Obviously, the answer is more resources and more money. There was money in this year's budget from the Victorian government, but I imagine you're going to tell me it's not enough and it needs ongoing commitment.
It certainly does, and look, it was a good start, I guess, from our perspective. But what it did do is it prioritised hospital beds, which of course are needed, but didn't look at prevention within the community. So what we need to do is to really build on that commitment, and it was a very large one, $705 million. but build prevention so that we don't have to continue to build new beds in hospitals and continue to expand those emergency departments into the future. Otherwise, we're going to be chasing our tails continuously. The best result for us is to prevent people getting into the hospital system in the first place, or at least reducing the number of people that are presenting every day.
Angus, Clelland, thanks very much for talking to us on ABC News, and we hope that the report and, more importantly, the people that need services get the attention that they need. Thank you.
Thank you very much.